AC joint separation. The anatomy of the AC joint includes the bony landmarks of the clavicle and the acromion process of the scapula. The AC joint is a diarthrodial synovial gliding type joint. The ligaments of the AC joint include the acromioclavicular ligament, which is the primary stabilizer, the corticoclavicular ligament, which stabilizes the clavicle, and the coracoacromial ligament, which stabilizes the acromion process of the scapula. Acromioclavicular separation has 3 grades. Grade 1, the AC joint is stretched and partially torn. Grade 2, the AC ligament is completely torn, but the corticoclavicular ligament is still intact. Grade 3 is complete joint separation. The acromioclavicular and the corticoclavicular ligaments are completely torn, and the joint capsule is torn. This type of separation may need surgery. The mechanism of injury for an acromioclavicular separation is a fall directly onto the point of the shoulder, that point being where the acromioclavicular joint is. The separation can also happen from being hit on that or a direct blow that can cause it to separate. Signs and symptoms of an AC separation include pain over the AC joint, swelling over the AC joint, loss of shoulder strength on the affected side. There will be a visible bump over the shoulder. There will be pain when laying on the injured side. There will be pain in any overhead activity, if they can do overhead activity, because there's going to be reduced range of motion. And sometimes the athlete can hear a popping or scratching sound when they move their shoulder. Some special tests for AC joint separation include the AC joint distraction test, where the examiner pulls down on the patient's arm, and if there's any pain with that around the AC joint, then that kind of indicates that there's a ligament sprain. The AC joint compression test, or the shear test, the examiner squeezes the clavicle and the scapula of the patient's shoulder, and if there's pain with that, then that's kind of a sign of more ligament sprains. The piano key or Paxinos test, the examiner pushes down on the clavicle of the patient and watches how it comes back up. And some reading of that indicates some AC instability. Predisposing factors of an AC separation could be previous AC separation, shoulder surgeries in the past, obviously participating in any contact sport, and then there's participating in sports where you just fall, like biking or skiing, wrestling, you get thrown around, maybe you fall on a hurdle, a bunch of ways you can just fall on your head or shoulder. The treatment of AC joint separation is to put the athlete in a sling and immobilize the joint. You want to rest the joint, you want to ice it, and begin some physical therapy. Anti-inflammatories can help the athlete with the pain and swelling around the AC joint. And most importantly, you want to start the athlete in a rehab program. Get their muscles working again, get them used to working their shoulder, and get them back to their sport, their activity as soon as possible, with them being comfortable that they're not going to re-injure their AC joint again. For an athlete with AC separation, you refer them to an orthopedic to get x-rays and an MRI. The x-ray would check to see if the clavicle or the acromion process of the scapula is broken. The MRI would look more at the ligaments, see if they're all intact, and if not, you can determine if surgery would be necessary. Prevention of AC joint separation is done by having the athletes wearing properly fitted shoulder pads. There's also special shoulder pads that you can, like an individual shoulder pad. For example, the picture in the bottom, that's an individual shoulder pad for an AC joint. A little extra protection. Sports are also done on, like, wrestling is done on a mat. So if you were to fall on or get slammed on your shoulder, you got a cushion to land on. Football is also done on turf or grass. Soccer's on grass, is a little softer. But for cyclists or hurdlers, they just got hard concrete sometimes. Something to work on avoiding falling on your shoulder and head, well, simply to work on stability practice. You're falling over that hard that you're going head first, you probably have some stability issues. You shouldn't be falling head first. Some Mulligan techniques to help with AC separation could include just having multiple range of motion exercises for the shoulder, like have the patient go in flexion, extension, ab and adduction, while you push down on the clavicle with different pressures, different angles. Same with the scapula. As they do these exercises, you can help the scapula to glide, and you can help them get their range of motion a little greater while hopefully avoiding causing more pain. There's also the strapping tape technique with K-tape, and I'll let the video explain how that's done. And this is the PCOW analysis. The population had 69 patients with acute AC joint separation that received different types of surgical reconstruction. The intervention: 30 patients received clavicular hook plate treatment. The other 26 received a double tightrope technique. The results were compared to see which surgical technique works best. The comparison: the hook plate group was compared to the tightrope group to see which surgery was most effective. The outcome was that both techniques proved that they both had excellent clinical results, although vertical instability is still common in some of the patients. And the time frame was between 2004 and 2010, so that brings us to a total of about 6 years.